It's almost that time of year, open enrollment, when we have to choose our health insurance plans, but there are concerns that even if you do decide on a provider, it'll drop coverage of the medication you need. That's totally legal. It's been happening all over the state. All new at 6, Columbus Bureau reporter Morgan Trow tells us how lawmakers are trying to help patients and why insurance companies are fighting back.
It's a mess. I was stuck trying to figure out, what do I take?
Weeks after getting locked into her health insurance plan, Natalie Hastings was surprised to learn her insurance would no longer cover her ADHD medication. And she says it hasn't been working out well.
And I forgot the rest of the question. Yeah. I literally forgot the rest.
She said to include her blanking out on our question because it shows what a big problem switching medicines can be. She had to change from the only medication that consistently works for her, Mydayis, to Vyvanse.
Even though ADHD meds are not in your system long term, that doesn't mean that switching doesn't affect how you feel on a daily basis.
Right now, insurance companies are allowed to change the medications they cover in the middle of a patient's yearly plan. State Rep and Dr. Beth Liston says this isn't fair and introduced House Bill 291 to prohibit any changes after a plan is chosen.
Insurance companies cannot do that and do a bait and switch for patients that think they're going to get one coverage and now get something completely different after the contract was signed.
Medical law expert Sharona Hoffman explains why insurance companies are opposing this bill.
They might decide that a certain drug is too expensive or that not a lot of their patients need it, so it's not worth stocking it.
She adds manufacturers can increase the prices of the drug, so insurers may feel they have no choice but to drop, and if they don't,
they might go out of business.
We reached out to 8 of the most popular health insurance providers in the state. None would comment. The Ohio Association of Health Plans did provide an argument that manufacturers are the ones who need their prices frozen. But for Hastings, what's important is losing access to the medication she needs.
It would be a relief to know that I would only once a year have to think about what medications insurance would cover for me and for my family.
This bill is bipartisan and will be heard in the upcoming weeks. At the Ohio State House, I'm Morgan Trow reporting.